Brown has slammed the exporting of 10 million COVID-19 vaccines partially produced in South Africa to Europe. That figure sits at around at least 30 million, but estimated to be much higher. It has the debate around vaccine inequality between rich and poor countries rages, with only 2% of Africans inoculated for the virus. For more on this, we're joined by the Health Justice Initiative founder and director, Fatima Hassan. Fatima, good evening to you, and thanks for your time. This contract that the New York Times has been able to get its hands on has been quite revealing in terms of what it is that South Africa agreed to in order to secure vaccines for at least a portion of our population. Talk to me about why this contract is so problematic.
Thanks, Kathy, for having me on the show. So the New York Times article, which you referred to, which was published yesterday, contains a set of quite explosive revelations. The revelations include that the New York Times has seen the contract between the South African government and Johnson & Johnson, and that the contract in two respects raises quite a number of red flags. The first is that it includes a provision which basically prevents the South African government from taking any kind of steps to limit exports or to introduce export bans for the filled and finished vaccines that Aspen is actually producing for Johnson & Johnson. That has meant that it's translated into what's called a waiver. Johnson & Johnson has basically received a waiver from the South African government, and it can therefore send any of the vaccines that Aspen fills and finishes or makes for it to any parts of the world. And it has chosen to send those vaccines to countries in North America and countries in Europe. In fact, Spain and Germany have both confirmed that they received doses. This was happening while South Africa was entering wave 3 and was facing wave 3, and while South Africa was experiencing its own delays in receiving sufficient number of supplies from Johnson & Johnson in terms of the 32 million dose contract that the South African government has signed. So basically, Kathy, what has happened is that the Johnson & Johnson appears to have used the agreement with South Africa to leverage an export waiver in its favor so that it can supply vaccines to the rest of the world ahead of Africa and ahead, obviously, of South Africa. The second aspect of the contract that they've referred to and they've reviewed and that the New York Times has seen relates to a very broad indemnification clause. Obviously, none of us have seen the contract. We filed an access to information request for it, and I think it goes to the heart of why we can't have secrecy in a pandemic, and the full contract now has to be disclosed, because we believe, and government has confirmed this to the New York Times, that they were told sign the contract or no vaccines for South Africa.
So one of the difficulties, of course, with the nature of this contract is that when compared with other contracts, it seems to go against what has been the global precedence in many regards, whether it's around the export waivers or even the culpability when it comes to the vaccines, especially should the need arise for there to be any kind of, civil lawsuits that arise out of this vaccine process.
So in some respects, we believe that it's the same, and in some respects, we believe that it goes a step further. What we have seen is a trend of pharmaceutical companies in relation to their contracts with governments in the global south trying to extract more concessions. So they certainly didn't ask the U.S. government to agree to a waiver on its rights to introduce export limitations, or the EU, but it is doing that in relation to the South African government, and we believe other governments as well in the global south. So, it's a classic scenario of the carrot and the stick kind of situation where Johnson & Johnson says, well, you really need vaccines for your vaccine program in your country. We'll give you the 32 million vaccines. And remember, Kathy, we don't even think that more than 6 million of that 32 million has actually been delivered. There's been significant delays with that particular contract. But if we allow you to have 32 million from our stockpile, basically you must make sure that you, in the middle of a pandemic, cannot use the Disaster Act or any other provision in the Constitution to stop us from exporting vaccines to countries that have enough supplies, that we believe are hoarding supplies, and that are already talking about booster shots. So it goes to a grave inequity and a grave injustice, particularly when the Aspen contract is meant to provide at least 220 million vaccine doses for the rest of Africa, which, as you know, the WHO has indicated only has about 3% full vaccine coverage of adults in Africa. So there's a really low vaccination rate in Africa, which could have been supplemented and attended to by the Johnson & Johnson supplies. Unfortunately, all those doses left our shores and they went to Europe.
Fatima, part of why this is also problematic at a broader level around this issue of inequities, that we've seen a lot of talk and commitment towards closing the gap when it comes to access to vaccines. But unfortunately, something like this speaks to a reality that points to the fact that, in fact, nothing is changing, and countries that have already had an oversupply of vaccines are, quite frankly, okay to continue receiving vaccines just to keep them in storage.
Yeah, and I think what makes us even more disheartening is that the vaccines were being sent to countries that are blocking the TRIPS waiver. The ability of many companies in the global south, not just Aspen, to be able to manufacture these vaccines, to get more into the system quite rapidly, to save as many lives as possible, is being held hostage by a very prolonged negotiation process at the WTO. We've talked about the TRIPS waiver opposition before and the countries that are blocking it and supporting it. So our vaccines will be sent to the very countries that are blocking the TRIPS waiver, and I think that's the first irony. And, you know, the second irony is that there was a lot of fanfare when President Macron and some of the German officials came to South Africa a few months ago to meet with President Ramaphosa about their partnership with Aspen. But in reality, like you say, when you look deep into this contract, it still prioritizes what we call VIP customers. Africa is not on the priority list, and South Africa is definitely not on the priority list. So much so that even though this has now been revealed and disclosed, Aspen is still going to be releasing a further 10 million vaccines, which is, you know, referenced by Gordon Brown in his op-ed for The Guardian, in the next few months. And only from October onwards is there some kind of indication that Aspen will only then be supplying for the African market. The reality of that is that only by the end of 2021, it's estimated that Johnson & Johnson will provide 50 million vaccines for the whole of Africa when the population is 1.3 billion, which means that the world has basically told Africa to wait, like it has for the last few months, but it will now wait some more, even up until 2022. It's a totally unacceptable situation. We're not going to get immunological equity, and people are basically going to get more sick and die for want of vaccine supplies.
Fatima Hassan, let me thank you so much for your contribution tonight. She is with the Health Justice Initiative.